Hi, my name is Rami Komrokji. I'm the lead investigator for the myelodysplastic program at Moffitt. We are going to discuss or talk about what is MDS. The myelodysplastic syndromes, also known as MDS, are a group of bone marrow failure disorders. Various subtypes of the disease exist with variable onset, prognosis, treatment options, and risk of developing leukemia. Let's talk a little about the bone marrow and what it does. The bone marrow is a very complicated organ with many working parts and process. All blood cells begin as hematopoietic stem cells. These cells are often referred to as factory cells or mother cells. In healthy persons, hematopoietic stem cells, the factory cells, develop and mature in the bone marrow to form the different blood cells. There are two main groups of blood cells produced by these factory cells: the lymphoid cells, T and B lymphocytes, and the myeloid cells, which produce red blood cells, white blood cells, and platelets. Red blood cells, often abbreviated as RBCs, carry oxygen to all the cells in the body. Platelets help to clot blood and stop bleeding. There are different types of white blood cells that come from the myeloid factory. These include neutrophils, basophils, eosinophils, monocytes, and macrophages. All of these are important to fight infections. Now let's talk about what happens to bone marrow in MDS. MDS is a primary blood disease of the mother cell or the stem cell. Myelo in Greek means marrow, and dysplasia means abnormal looking cells. As stem cells are dividing and exposed to different types of injury, mistakes occur in the control center of those cells. We call them genes, which leads to development of new generation of cells. We call it clone, carrying those genetic mishappenings, where the MDS clone ultimately dominates that bone marrow or the factory. The MDS clone is inefficient producing blood cells as the normal cells. Thus, the cells produced do not live as long as the normal cell. The MDS is considered a primary blood cancer and is a spectrum of disease, where some patients have what we call as a lower risk disease, where there is inefficient production of the blood cells and low blood counts only, but some have higher risk disease where there is increase in early immature cells. We call them blasts or leukemia cells, or referred to as myeloblasts. Those are cells that are stuck in that line of production at early phase, which is closer to acute myeloid leukemia. All over, patients with MDS are at risk of progressing to AML or acute myeloid leukemia. 30 to 40% of patients will eventually develop AML, more in the higher risk patients. The MDS clone typically acquires other hits or mishappenings that leads ultimately to the progression to acute myeloid leukemia. In patients with MDS, the development and maturation of the factory cells, as we mentioned, is impaired. The result is too few cells or low blood counts known as cytopenias, and cells that do not function properly. Red blood cells production is affected most often in MDS, causing what we call anemia. The white blood cells, in particular neutrophils and platelets, may also be abnormal in number or function because they come from the same myeloid factory cell. The most common initial symptoms in patients not yet diagnosed with MDS are related to the type of cytopenia or cytopenias they have. Red blood cells are the oxygen-carrying cells. When they are below normal, it's called anemia. Common symptoms of anemia may include fatigue, shortness of breath, your heart skipping a beat, and in some cases dizziness. White blood cells fight infection, in particular the neutrophils. When these are below normal, it's known as neutropenia, and you may develop fever, recurrent or prolonged infections. Platelets help to clot blood and stop bleeding, and maintain the tissue lining many organs including the lung and blood vessels. Low platelets, known as thrombocytopenia, may cause you to bruise more easily or have unexplained or more severe bleeding. You may also develop small pinpoint red dots on the skin known as petechiae. The cause of MDS is unknown in more than 80% of diagnosed patients. What we do know about trends in patients diagnosed with MDS is that first, MDS is almost twice as common in men as in women. MDS is more common as we age. The average age of patients with MDS is 73, and 86% of the patients with MDS are older than age of 60. Exposure to certain chemicals and other toxins are known to increase the risk of developing MDS, such as chronic and high exposure to benzene, other solvents, insecticides, or herbicides. There are no known foods that cause MDS. While alcohol consumed on a daily basis may lower the blood counts, red blood cells, and platelet counts, alcohol is not known to cause MDS. Chronic tobacco use or exposure has been linked to the development of MDS and is being evaluated in ongoing studies. Patients who receive certain types of chemotherapy or radiation treatment for other cancers may be at increased risk for developing treatment-related MDS. MDS that develop after use of cancer chemotherapy or radiation is called secondary MDS and is usually associated with multiple chromosome abnormalities in cells in the bone marrow. This type of MDS is often more difficult to treat and more often develops into AML. Finally, inherited genetic predisposition for developing MDS and congenital abnormalities are rare. MDS is not contagious. All of these factors may damage the myeloid factory we talked about and the bone marrow environment, known as the microenvironment. A bone marrow biopsy and aspirate and peripheral blood sample are necessary to make the diagnosis of MDS. The specimen is analyzed by pathologists specializing in blood disorders, known as hematopathologists. Some of the findings that are common in MDS include dysplasia, abnormal shape and appearance, morphology of the cell, chromosome changes, also known as cytogenetic abnormalities, changes in the bone marrow support system, also known as the microenvironment, and molecular changes in the cells or the microenvironment. Failure of the bone marrow to produce mature healthy cells is a gradual process, and therefore MDS is not necessarily a terminal disease. Some patients do succumb to the direct effects of the disease due to bone marrow failure and cytopenias, unfortunately. In addition, roughly 30% of patients diagnosed with MDS will progress to acute myeloid leukemia. You can learn more about how the bone marrow works and what happens to the bone marrow to cause MDS in Chapter 1 of the Building Blocks of Hope, Understanding MDS. Thank you.